To begin with, patients come to us with lots of teeth that are compromised. It is not uncommon for these patients to lose their teeth and have implants, but naturally saving teeth, it's much healthier for them if possible. So using the laser and to try to save the very compromised teeth is possible, can happen, not always, but that would be the first step. I always advise my patients, let's try to save the teeth. If we cannot, then we can always look at implant as next options. Implants are a great replacement for natural teeth, as replacement for natural teeth that cannot be saved. And implants are very successful, but they can have problems. And number one problem is infection they could develop. And the laser surgical cleaning of the implant is very helpful, because again, if the infection around the implant is deep underneath, if we cut open the gum to remove the infection, we have caused damage, and that change of the gum level becomes permanently receded and a problem down the line. However, the laser can help us to get down underneath the gum, and with laser energy and other tools, remove the infection and minimize those damages to the benefit of the patient. And again, that's where the other referrals I get a lot nowadays are patients with periodontal disease or peri-implantitis around their implants, and the referring doctor is desperate to try to save those implants. What's the option if we lose those implants? More costly replacement. So the benefits are great to try to save them, and yes, there's hope to do that with the laser. I can share with you one of the biggest factors to take the big step. As they always say, working on families and friends are very difficult, and I had to help one of the relatives of mine, very close relative, and she went through treatment of her gum disease. I got rid of her infection with traditional approach. However, every time I saw her, she complained about sensitivity, recession. She's happy with the outcome. I've saved her tooth, but she ended up having all those challenges that I felt so bad about it. And it came to me that I better take the next step for the benefits of my patients, to add another tool to the practice, not only to help me get rid of the infection, save teeth for them, as well as minimize all the complications, and many of the complications, not all of them, many of the complications traditional surgery could cause. At the same time, traditional surgery has its true place in our field. I still do it, but the laser as an initial tool to get rid of the infection of the periodontal disease is to the best interest of the patient. I do not jump and use any product that hits the market the day it comes in the market. I'm always very hesitant. I review the literature, make sure that I give it time, 4 to 5 years, sometimes 10, until I'm very sure that product, that tool, that machine is there to benefit my patients. I never try anything on my patients. I make sure it's a product that is proven to help them, and then I take action and bring it to my practice and provide it for my patients. Unfortunately, periodontal disease is a situation most patients are not aware of it, and when they become aware, and when the dentist realizes that there's advanced periodontal disease, not always, but the common action is to discuss removal and replacement with dental implants because of the rise of interest in dental implants. The reality is there is options to save teeth, and that option relies on treatment of gum disease, which does include the deep cleanings by the hygienist, scalp root planing, and the laser surgery for the more advanced cases to save those teeth. And yes, they can be saved, not all, but still a good large number have the opportunity to be saved. Dental implants are in the rise because they're a good option to save compromised teeth, but my concern is there are situations that a patient and doctors decide to rush into implant replacement when they haven't looked into treatment of the gum disease, which could save the teeth and long run could be better than having a dental implant.